My name is Gene Rule, and I'm one of this collective of volunteers that put this program together. My job has been to do the mailings and make the coffee, but I don't have to make coffee now, but you can make your own coffee. And while you're doing that, let me tell you a little bit. About the library and the institute here, because the Nebel Proctor Marxist Library was formed with the collections of two people, very extraordinary individuals, Carl Nebel and Roscoe Proctor. Nebel was a noted Marxist economist who fled Nazi Germany in 1934 and came to the United States. After working in the New Deal and in the Navy in World War II, he ended up as a full professor at San Jose State University until his death in 1985. Roscoe Proctor was born in Texas and moved to the United States, or California, in the 1940s. And he had a career as a farm laborer, longshoreman with the ILWU, and community organizer in Oakland. He was a member of the Communist Party USA's political committee and served as secretary for the trade union department. Now, the collections of Nebel and Proctor form the core that became the Nebel Proctor Marxist Library for Social Research. We moved to our present location at 6501 Telegraph Avenue in Oakland in 1996. And since then, the library has served as a community center, providing meeting space for political groups and to organize young people here in Oakland, continuing Roscoe's mission. And about the same time, the Institute for the Critical Study of Society was formed to further the library's goals of preserving our written heritage, as well as supporting emerging struggles for racial and gender equality and for socialism. The members of ICSS are active in different aspects of people's struggles in the Bay Area and globally. Some of us are affiliated with particular political parties and tendencies, others are not. We respect one another, but we do not necessarily agree on all issues. Accordingly, the opinions that you will hear today and other times are those of the authors only and the speakers only, and do not represent any kind of group consensus on the issues discussed. We are united, however, in our respect for the work of Karl Marx and our belief that his work will remain as important for the class struggles of the future as they have been for the past. And as a group, we continue to draw inspiration from the work of Karl Marx, including his 11th thesis on Feuerbach. The philosophers have only interpreted the world in various ways. The point is to change it. And today's program has been organized by, I would say, an exemplar of this program, Tony Ryan, who is a founder of the National Network on Cuba, a longtime activist on Cuba. So I'm very happy to turn the program over to Tony, and he will do what he does so well. Over to you, Tony.
Thank you very much, Gene. Excuse me. I'm really happy that this is happening. I think we're going to have quite a number of people tuning in, so to speak, which is all to the good. I've been spending the last couple of days getting the word out to Cuba Solidarity activists and others who are interested in this incredibly important example of medical internationalism on the part of Cuba. I'd like to just say I was a co-founder of the National Network. There were a number of people that were involved in it back in the early 90s. And since the network has grown leaps and bounds all over the United States and has worked very, I'm sorry, I'm coughing here a little bit, all over the United States, and has collaborated with obviously people and organizations in Cuba, but also has developed a really important relationship with the Canadian network on Cuba. And in the recent period, we've seen tremendous amounts of people coming forward wanting to do work around Cuba. And I think because people are cooped up in their houses and a lot of other things. But I think that people are very, very important. I mean, we've had some tremendous interviews and things online that have shown this increasing interest on the part of people to move forward around this question of supporting Cuba's medical internationalism. So I basically, I want to dedicate today, this last Friday, we lost, and Cuba lost, but all of us lost a very important figure in Cuban culture and society, Eusebio Leal, who was the historian of the city of Havana. And while he wasn't a doctor or a scientist in the sense of, or medical person, he was someone who fought on other fronts. And he's one of the people very much responsible for the saving of Old Havana. And he's been deeply involved in historical preservation, especially in Old Havana, but other parts of Cuba too. And unfortunately, he passed away this last Friday. And, you know, the country is in grieving, and rightfully so. So I'd like to dedicate it to him, Eusebio Leal. He's someone that I had the pleasure of meeting several times. And so I just want to dedicate this whole event to his work, as well as the work that's been done by numerous people internationally and in Cuba around this development of making Cuba a medical power in the world. So, so the sad news, but it's someone we want to remember in this time. So, okay, so moving forward in this program, the first person that's going to speak is Dr. Abraham Vela, who is practicing medicine in Southern California. He is someone who is a graduate of the Latin American School of Medicine, the ILAM in Spanish letters. He graduated, I think it was in 2016, I believe, and he's going to speak, and I'd like to introduce him, but before I do that, and then secondly, we'll have Gail Walker from Pastors for Peace, IFCO, and she will speak, and finally, there will be some remarks by David Paul, who's a local Bay Area activist, and one of the key people historically has been doing a lot of work around a lot of things, Cuba, Venezuela, various other situations. So he will speak, and then we'll have, excuse me, then we'll have a comment Q&A section, and that's basically sort of the outline. So one thing I would ask, and I'll stress it again, is that in the comments section, I really urge people to not go on and talk too much. And just, people are certainly entitled to speak to the issues. If they want to raise a question, people should feel free to ask that question. We want to have a dialogue that is fruitful for us. So let me just say, I got to move over here, but I want to introduce Dr. Vela, Abraham Vela. I have to read from my other computer here, but this is, he submitted this to me, sort of a biography, I guess, and it says, from Dr. Vela, I grew up between Guatemala and the US. It was like navigating two different worlds, two different languages and cultures, but both worlds share a common reality. Access to health is not a human right in either Cuba, in either Guatemala or the United States. This sparked my interest to study medicine. When I was 18, I had the opportunity to be part of the creation of a free student-run clinic in San Francisco's Mission District. The mission was and is to provide comprehensive care to underrepresented and underserved communities. Thanks to my involvement with Clínica Martín Baró, I not only learned more about the disparities that exist in our country, but I was able also to see how my community benefited from having access to healthcare that formed and that focused on prevention. I worked alongside community projects and provided a safety net for the most vulnerable. The necessity to make primary care available to everyone became obvious to me. My search to find ways to better serve my community led me in 2010 to enroll in the Latin American School of Medicine in Cuba. It trains students from the most marginalized communities in the world to be doctors. I have interacted with people from every continent. I began to understand different cultures, religions, languages, but no matter how different our worlds were, the lack of access to comprehensive healthcare was a common theme. In my first class of medical school, I learned my most important lesson, which one that defines the way I want to practice medicine. Treat each patient as a biological, psychological, and spiritual human being. I learned that physicians can be healers, advocates, teachers, and mentors. All of that I aspire to be. So Abraham Vela, Dr. Vela, welcome to this program. Thank you very much.
Thank you, Tony. Appreciate it. Sorry, that was a long bio. Yeah, let me take these off, actually. Can y'all hear me?
Yes, we can hear you. Great.
All right, perfect. So I'm Abraham. I am a graduate of the Latin American School of Medicine. I graduated in 2016, almost, about 4 years ago now. I was still in Havana with my family, celebrating and looking forward to the next steps. As Tony mentioned in my bio, I actually always wanted to go into medicine. I just didn't know how. I'm a first generation college graduate, first generation medical school attendee, and I didn't know how to navigate the system. I grew up in Guatemala, I grew up here, and it was all so new to me every time I transitioned to a new step. High school was new, college. I remember I was in my confusion, I made an appointment with my counselor, because that's what they're there for, to counsel you and advise you and guide you. I remember I was at San Francisco State University, and I sat down with him and I told him, this is where I want to get. This is where I'm at now. And he went over my paperwork, he went over my grades, and said, why don't you pick a different path? Something more achievable. And it didn't destroy me inside. It just really unmotivated me to continue to study in a educational system where I have to pay hundreds and thousands of dollars to get basic education that people get for free in other parts of the world. So I kept going to school. Other times I was advised to join the Army so they could pay for my medical school. And of course I wouldn't do that. So I met a professor in San Francisco State University, and I was introduced to Latin American School of Medicine. I went to a conference that Reverend Walker had in Oakland in Langley College a couple years before I enrolled, and he gave me an application. And I worked hard, got my pre-med requirements done, and I applied. I got in. And it's the best thing that's ever happened in my life, really. It's really what made me who I am now. I didn't see myself going to medical school in the US. Through this clinic that I volunteered, I did see how the medical system worked here. I saw how medical students were formed here. And I became really critical of it, really, really critical. to the point that I decided I will never study medicine like that. I will never go to med school here. And I don't mean to talk bad about my colleagues, because most of my colleagues are U.S. medical graduates. My criticism is towards just the educational system as a whole, from preschool all the way to medical school, law school, whatever school. It's all a for-profit system. When you have profits in your mind and you don't care about educating young minds, you don't care who graduates, you don't care who gets into the school. What matters is who can pay for the school. And that's why our country is the way it is right now. You apply the same system to our healthcare system, and it's the same thing. You're working with a for-profit mentality, which prevents you from doing the actual best care for every patient, especially for those that are not insured, and especially for those that are not able to pay for medical services. So I enrolled in Latin American School of Medicine, and I quickly learned, like I mentioned there, is you go to school and everything is different, even the reality in a classroom. I went to college here, so I know what it's like to take a test and be graded on a curve. Be graded how, depending on what the highest score was. So it's this competitive mindset that you have within U.S. classrooms in college, whereas in Cuba, the first thing they told us was, you are all working for the same goal. We don't grade on a curve here. We grade by merit. You're not competing with each other. And it was completely the opposite. When, let's say, my classmate did poorly, or I did poorly, or I got a 2, which is like an F or a D, and my classmate got a 5, which is an A, the teacher, the professor, the doctor would come up to the person that got the 5, that got the A, and ask them, why are you not helping your classmate thrive? And they'll ask the person that's not doing so well, why are you not reaching out to your classmates so they could help you thrive? And to me, that was just life-changing, really, like to see that another better world is possible here. I want to talk a little bit more about the school and the scholarship. I'm sure Gail will touch on it too. School serves, and I'm sure you're all familiar with, if you have any more questions regarding the school specifically, please feel free to ask me at any time. But the school has received students from over 100 countries, pretty much all the continents in the world. It's an experience that is not only an education, a medical education, but you get life experience, you get culture knowledge, you get knowledge about religions, foods, traditions, languages, and that makes a well-rounded person. You know, that graduates well-rounded physicians that are willing to go where nobody else is willing to go, willing to work with the patients that nobody wants to work with. It prepares you for situations where you don't have CT scans, where you don't have ultrasounds, where you don't have even X-ray machines. It prepares you to think like that. And when I say that, I don't mean that Cuba doesn't have these. Cuba has all these instruments and medical technology available to them. But the focus is first on touch, on speaking, on interaction with the patient. We're always taught that we should have a diagnosis in our heads before we order any labs. And that's how we were trained. Whereas my training here, we usually just skip to the labs and figure out what's going on with you. I remember I went to the doctor for the first time here in the US after graduating med school. And of course, I had been used to being treated in Cuba, right? And where nobody asks you for your insurance card, nobody asks you for a co-payment, none of that. So I was treated for blood pressure in Cuba. And when I left Cuba, my doctor said, I'm going to give you a year's supply of medication so that, because I know how difficult it is in your country to get medication. So I'm giving you a year's supply, and, you know, it goes well. Who would ever do that for you? Here, at least. I don't know anybody or any medical system that would do that. When I went to see my physician here, literally, I timed it, right? Because I wanted to compare. I was there for 6 minutes, and most of the time was me filling out paperwork. And when I left the office, he said, here, do all these labs so I could really get to know you, so I could know all of you. So this physician's intentions was to get to know me through my blood work. And of course, I didn't go back. I mean, who doesn't listen to someone's heart? What physician doesn't touch a patient? And that's just the reality. And I've been able to see that now getting to residency where I myself have to work in a system like this. And to me, that's been the hardest part I ever done in my life. Transitioning from a world where education, healthcare, housing is a human right to a world where it's not, and yet work under that system, it hurts a little bit every day. It hurts a little bit because that's not why I went to medical school for. That's not why I became a physician for. But it's important for more physicians like myself, physicians that graduate from Elam, or just physicians in general with a different mentality to join this medical system. It's the only way it's going to change. My intention is to change it from the inside. And little by little, you could change people's minds and little by little create change within your own micro healthcare systems. And we're slowly starting to do that in my program where I'm at. I'm in Pomona Valley in LA County, where we're starting to see more involvement with the community. We're starting to receive more patients that otherwise we wouldn't see before. And to me, that's a small accomplishment for a patient, but for a patient that's never seen a physician, it's a huge thing. So I think that's what Elam does, not only for the US, but for the world. It creates more access to healthcare to people who didn't have any, right? Transitioning from Cuba to here, people, when I went to Cuba, people would tell me, why are you going to go over there? They're going to steal your shoes. There's no food. There's military personnel over there. You're from the US. They don't like you. And really, it was the complete opposite experience for me. It's the Cuban people always tell you, our issues are not with you. They're not with the US people. It's with the US government, who is imposing this genocidal blockade on our country and makes us struggle every single day. It is a struggle because of this blockade. What was most difficult for me was actually transitioning back to the US. Yeah, my family's here and this is where I grew up, but leaving that world, leaving that safe bubble that I was in, that was Cuba, was extremely difficult, but that's what we signed up for. That was the moral contract that we signed with Elam, with Fidel and the people of Cuba to come back to our communities and make change happen, try to replicate the healthcare system that they have, the educational system that they have. So it's not just the medicine of Cuba. When you think about the international missions that go all over the world, including places like Italy, which are considered rich first world countries, it's not just medical personnel that goes there. It's not just nurses and doctors. You know, Cuba sends teachers all over the world to educate other teachers. They send engineers. They send public health officials. They send artists to bring more education, to bring more resources, to provide the education so that the people from that country can create their own spaces. So I think it's important to really acknowledge that it's just a complete humanistic international country that provides not only medical services for everybody. Now, going into the medical aspect of it, I'm sure you've all heard of different Cuban medications that unfortunately are not readily available to people in the US. Do any of you all know, or you maybe, if you want to share, have diabetes? Yeah, I think a lot of you know at least one person with diabetes. I know a lot of people with diabetes. And did you know that diabetes is the leading cause for foot amputation in the United States? Over 80,000 people in the US lose their feet or their foot or their legs due to diabetes. Cuba developed a medication called Everprop-P. I'm sure you heard of it, which is similar to what we call stem cell regeneration. And it's injections that are injected into the affected foot and helps regenerate the foot from diabetes. And it has been able to prevent over 70 amputations of diabetics. So that's, out of 100 people, 70 people won't lose their foot because of diabetes. And this medication that affects the US widely, and it's not just, imagine, it's not just losing your foot. What other health complications come along that? I know we just focus on the medicine. How are we going to rehab you? How are we going to create you a new leg? It cuts a person's lifespan for some reason that we don't even know why. But we do know why, because this person will likely not be able to work. The emotional effect is going to have on her health. The spiritual effect is going to have on her health. All of those stressors are going to reduce this person's lifespan. Another medication is a medication designed to reduce the spread of lung cancer to other parts of your bodies. That's the Sinovac vaccine, which fortunately now there is some collaboration between a US lab and Cuba to bring that medication to the US. The problem is you're introducing a medication into a capitalistic society. So what's going to take the longest to figure out how to use this medication is who's going to make a profit from it, who's going to sell it, who's it going to be available for. And I think it's similar to what's going on to the coronavirus vaccine. I'm sure it's almost done, but they need to figure out who's going to sell it, who's going to make money out of it, and who's the people that pay. We do. So they are charging us for our lives, pretty much, and we see that. I see that every day, at least in our hospital, in our healthcare system. Anywhere you go, literally your symptoms are paying the whole system, and really is not fair. I could go on and on about more medications, about more collaboration, but really everything you do for Cuba, you're really doing it for the world. You're doing it for a country that provides everything before mentioned to the planet. So you're really trying to make this planet a better place by showing your solidarity to Cuba. So personally, I thank you for that. I thank you for supporting projects like this one. I thank you for being here. Thank you for showing your solidarity, and please continue. I really appreciate, talking to new people that are not aware about these issues. The more people that we get support from, hopefully the faster we could end this blockade. Hopefully collaboration can happen. Hopefully we'll be able to access more collaboration with Cuba. And hopefully we get more students down to Cuba. Right now, I believe they are accepting 10 medical grads, but I'll let Gail go specifically into that. I appreciate you all for being here. Please let me know if you have any questions. Tony has my email. Shoot me an email if you have any questions as well. And thank you all.
Tremendous. Thank you very much. Tremendous, Abraham. Very good. Before we go to Gail, I just want to mention a couple of things that I think set the context. From day one of the Cuban process in 1959, beginning in 1959, the triumph of the revolution, but actually going back to earlier, there's always been progressive forces in the medical and scientific communities that wanted to see a better medical system develop in Cuba, and that they had a long-term goal of making Cuba a medical power. And there's a lot of information about this that's available, books and articles and a lot of things. I would suggest if people are able to, as soon as they can, there's a website called Saving Lives. And it's a really important website. It's Saving Lives US Cuba Normalization.org. And you can also look it up online. It's a very important site, has a lot of information. I believe this conversation will eventually appear on that site in probably a couple of days. All this stuff is being recorded. But it's very, very important to understand that this was not just somehow invented in 1995 when the Henry Reeve Brigade was actually formed, which is now in some 30 countries, I believe, all over the world. But that from day one in the Cuban process, they developed a medical system, first for the people of Cuba, but then with the goal of internationalizing it, making the country a medical power. And that's something I think needs to be understood. Now, one other thing, and then Gail will come forward, but some people have asked me, and I think other people have asked too, well, who is this person, Henry Reeve? Well, in brief, Henry Reeve was a US citizen. He participated in the Civil War on the Union side, and eventually, at the end of the war, he ended up in Cuba and he joined up with the revolutionary forces that were fighting against Spanish colonialism. And he rose through the ranks of the Cuban rebels. He rose through the ranks and became a brigadier general. And he eventually passed away in the early 1870s. And in 1995, Fidel, at a conference of appropriately medical people, epidemiologists, called for the creation of the Henry Reed Brigade, International Medical Brigade. And that they spent time, they were in West Africa when the Ebola outbreak occurred and played a tremendous role. So much so that the Obama administration at the time admitted that the Cubans were playing an important role, and that there was even some collaboration between U.S. doctors and the Cubans. Also, there are a lot of other things. They were all over the place. But before that, before 1995, Cubans were on the field internationally, all over the world, taking care of different things. So I think it's important to preface all of that. I'm sorry, I don't mean to go on forever here, but I think it's really important to understand that this is not a new situation. Cuba, from the early days, has tried to develop its ability to deal with healthcare. And yes, it's a poor country. It's under a terrible blockade, an immoral blockade, even illegal blockade, but they still manage to share their resources with a lot of people all over the world. So I'm going to introduce Gail now. Forgive me, I'm trying to really be careful, but I think it's really important to understand the situation, that it predates 1995. So Gail Walker is also one of the founders of the National Network on Cuba. Her father started Pastors for Peace, IFCO, quite a while back. And early on, he became very involved with the development and support of the Cuban medical school, the ILAM. And then he passed away quite a while back. But Gail stepped in and is now the director of Pastors for Peace, IFCO. And it's a very powerful, important organization that if people don't know it, they should know about it, and the work that they've done. And it's not only the medical school recruitment, but it's also, I think pretty much every year for quite some time now, there have been these delegations of people going to Cuba, bringing material aid from the United States. And sometimes they had trouble at the border. Sometimes they were able to get the material through. But it's an organization that has a real importance to the Cuba Solidarity Movement, and it's fundamental. So Gail, please step forward. Thank you, Gail. Gail Walker. Hello? Gail? People hear me?
You need to unmute her, maybe.
Yes, please.
Yeah.
I'm going to ask her to unmute herself.
Okay, there we go.
Yeah.
Oh, good.
I was trying. Okay. Thank you. Can you all hear me? I don't know if it's better with the headphones or not, but if you can hear me, okay, great.
It is very good. Thank you.
Thank you. And thank you, Tony. Thank you for organizing this this event. And it's always great to share the platform with an Elam grad, and appreciate always hearing from Abraham. I learned something different every time Dr. Vela is on the mic, so I appreciate that. I want to just say that, I think that want to really kind of speak to some of the things that Tony had asked me to speak to, but that it's indeed, a really critically important time to be talking about medical internationalism as the world is struggling to combat this global pandemic through the organization that I work with, IFCO, the Interreligious Foundation for Community Organization, and our special project, Pastors for Peace, and the National Network on Cuba, for whom I serve as a co-chair. Many of us who are friends of Cuba have helped to share information about Cuba's work in the international medical arena. The latest battle front for Cuban medical personnel has been against coronavirus. And as we see how many countries are struggling to combat COVID-19, we see that Cuba is, like I like to say, is once again leading the way by providing much needed life-saving support. Cuba is doing in the same way that it did in the fight against apartheid, by sending soldiers to the front line, in the same way that it stepped up against Ebola. It's running toward that fight rather than running away from it. And as many know, Cuba's offer to help other nations is not new. Historically, Cuba has helped countries in need, from hurricanes that devastated Central American countries like Nicaragua and Honduras, to earthquakes that ravaged Pakistan and Haiti, to fighting the deadly Ebola outbreak in Western Africa, and today to the fight against coronavirus. As it's done in the past, Cuba is offering its doctors and medical expertise to multiple other countries fighting COVID-19. Since the pandemic began, Cuba has deployed tens of thousands of medical workers to dozens of countries. The list is really quite extensive, and I'm sure it's more than what I could mention here, but including China and Italy and Spain and Suriname, Jamaica, Dominica, Belize, St. Vincent and the Grenadines, St. Kitts and Nevis, South Africa, Venezuela, Nicaragua, Honduras, and many of these doctors, these medical experts, have been sent to reinforce existing medical missions. But as Dr. Vela was explaining and Tony was explaining, it's really a part of Cuba's DNA. This is just an example of that. Recently, there's been a tremendous effort to educate people across the US, across the world really, about Cuba's heroic work on the medical front, and to encourage nomination of Cuban doctors for the Nobel Peace Prize. Selflessness, solidarity, and working for the common good characterize the Nobel Peace Prize, what it should be about. And those traits are very appropriately describe Cuba's Henry Reed International Medical Brigade, which has saved over 80,000 lives since 2005 and has been fighting COVID-19 in more than 25 different countries. And that's why many of us are supporting efforts to nominate Cuba's medical personnel for the Nobel Peace Prize. More than 30,000 people have signed a petition in the United States, and there are petitions in other parts of the world, but in the US, asking the Nobel Committee to award Cuba's Henry Reed Brigade the Nobel Peace Prize. And for information on that, folk can go to www.cubanobel.org. That's www.cubanobel.org. But it's a tremendous campaign. And as this conversation is really timely, also as we approach the 15th anniversary of Hurricane Katrina. It's hard to believe that 15 years ago, New Orleans was slammed with a deadly, devastating hurricane that claimed the lives and homes of thousands, mostly poor Black families. And sadly, the exact numbers will probably never be known. Many of us across the world recall watching helplessly as our friends in New Orleans were trapped, many clinging to their roofs during the deadly the Category 5 hurricane, as bodies lined the streets, and the Superdome, Louisiana Superdome, was packed to capacity with people struggling for basic supplies, including food and water and access to basic hygiene. And there were reports of deaths and rapes. It was a horrific scene. And that is why it was so heartwarming when Cuban President Fidel Castro offered to send doctors, the Henry Reed Brigade, to New Orleans to assist. And it was so deeply frustrating, painful, and angering when the Bush administration rejected Cuba's generous offer. And almost 15 years from today, 15 years ago today, that pain of that rejection of Cuba's offer to do what it does best, to offer to its medical personnel, to offer a lifeline. That rejection still stings, and God knows how many lives were lost because of it. But IFCO, as an organization committed to the fight for social justice since 1967, has engaged in numerous campaigns for the poor and the disenfranchised, from supporting the rights of women and children and workers, to supporting the enfranchisement of Native Americans, political prisoners, fighting the violence of the Ku Klux Klan, the US government's repression here in the US and abroad. And on the international front, IFCO's work in Western Africa to address hunger and drought and support of African liberation struggles, pushing back against apartheid. In the 80s, we began educating people, primarily in the US, about the impact of US foreign policy in Central America. And at that time, Ronald Reagan, then President Ronald Reagan, was referring to the Nicaraguan Sandinistas as terrorists, and the Contra, the former National Guardsman of Nicaraguan dictator Anastasio Somoza, as freedom fighters. And we at IFCO found out firsthand that nothing was further from the truth. While co-leading a study delegation with my father, Tony mentioned him, both the Tony and Dr. Vela, my father, the late Reverend Lucius Walker. As our group was traveling on a passenger ferry, we were fired upon in an ambush by US-backed Contra forces that resulted in 10 being killed and 29 people being wounded, and one of the wounded was my father. And as he lay in the hospital, literally contemplating how to respond to the brutal attack with weapons paid for with US tax dollars, he conceived of the Project Pastors for Peace as a way to initiate an alternative people-to-people foreign policy. And that's when IFCO began organizing caravans of humanitarian aid, not as an act of charity, it's really important to say that, but as a symbol of the kind of relationship that we want to have with our global neighbors. That's a real people-to-people foreign policy. This work in Central America led us to organize similar initiatives in Cuba, travel challenges through our friendshipment caravans and educational delegations to allow people to see and experience Cuba firsthand, and to combat the massive misinformation campaign in the United States and in many parts of the world about Cuba. So this work, all of this work led to, really resulted in our Cuban friends asking us to facilitate the process of identifying US candidates for scholarships to attend the Latin American School of Medicine in Havana. Scholarship recipients only needed to commit to giving back by practicing in medically underserved communities, very much in the way that Dr. Vela just described. He painted a wonderful picture of Elam. And I really want to just take a moment to say, you know, when I heard your story, Dr. Vela, about being discouraged to follow your dreams, becoming a doctor, it's very similar to what my father experienced, which is I'm sure why he was so passionate about the Elam Project. As a young man, a young Black male, born in the United States of America in 1930, I want to paint that picture, he was encouraged to pursue vocational training. And there's absolutely nothing wrong with that, but that's not what he aspired to be. And he was not really encouraged to pursue higher education. He fought back, he stubbornly pushed through, and the end of his life, he lived 80 long years. He was a minister, an educator, a social worker, a community organizer, a person who really believed in, if a person was given the tools that, you know, that they needed to be able to pursue their life's goal, that they could really succeed. And that's really why when Comandante Fidel Castro decided to take a naval barracks and convert it into an internationally renowned medical training facility, teaching tens of thousands of young people from more than 125 different nations, including the US, the very country that has blockaded it for more than 6 decades, that he really resonated to that, my dad. He felt this is what a great opportunity for a young person who may have dreamed to be a doctor, but simply did not have the resources to be able to afford the $250,000 plus to go to med school here. And he saw it as a real gift. And that's why this project was always so very, very important to him. And I think to all of us who support ELAM, students and graduates, and support this idea of really this idea that Fidel had of training people to go back to their home countries and provide service where it's needed most. Not to be the savior, right? Not to be the ones riding in on the white horse to save the poor people of this or that nation, but to train those nations' youngest people to go back and actually provide much needed medical care is a beautiful mission. And you can see I get really passionate about it. And I think that's why we've really enjoyed being able to be have the distinct honor of facilitating this process since the year 2000. To date, there are now 195 graduates of the United States. Again, important to note, the very country that has imposed a genocidal blockade against Cuba for more than 6 decades. And we just had the opportunity to celebrate the graduation of this new round of graduates, 11 new grads. Every year, IFCO hosts a graduation dinner with the grads and their families. And this year, because of COVID, we had to rethink how we'd celebrate the graduates. And we just had a beautiful virtual graduation celebration this last week for 11 new graduates. Angela Davis and Cuban Ambassador Jose Ramon Cabañas were among those who addressed the graduates, giving them inspiring words of encouragement as they step forward as doctors. And it was a really wonderful program. I just put in the link earlier, I'm sorry, in the chat, and I can do it again, the link to where people can find the graduation celebration. But through the ELAM scholarship program, IFCO's intent has always been to advance to advance Fidel's dream to help educate culturally competent physicians to provide medical care across the globe, to train revolutionary doctors to join the noble army of white coats to work to save lives. And due to COVID, the window for applying for the scholarship is still open. So anyone interested in becoming a community doctor and wants to learn more about this program should go to the IFCO website. That's ifconews.org and look for the medical school tab. And we're actually holding interviews right now virtually. We had a couple of socially distant in-person interviews, but the opportunity is still there. So we want to encourage as many people as possible to spread the word about this program. And this is just one example of how Cuba's medical internationalism is at play in the US. Dr. Vela spoke about the examples of Herbapro P, of Simivax, and there are others, as he mentioned, examples. And then today, Cuba has taken on coronavirus. Cuba is successfully administering the human recombinant interferon alpha 2B for COVID-19 patients. Tony just mentioned the Saving Lives project. There is a project, this project is one that's supported by many groups, IFCO, the NNOC, the US-Cuba Normalization Campaign that is, by the way, organizing a conference later this year on Cuba. Under this project, Saving Lives, we're calling for Cuban doctors to be allowed to come to the United States to share their expertise in the fight against COVID-19. Hundreds of medical professionals and academics and elected officials have endorsed a statement calling for medical collaboration with Cuba, incorporating Cuba's interferon alpha 2B in clinical trials. and ending the attempts to stop other countries from accepting Cuban medical assistance. Some of you may have heard, Trump and his cronies claims that these Cuban doctors are slaves, that they're being, forced to go to other countries, and they're being maltreated. When indeed it's this wonderful, noble gift that Cuba has offered the world. So it's really this campaign is an attempt to stop, this bad mouthing of Cubans' medical internationalism, and as well as preventing measures for Cuba from importing medical equipment and medicines. I'm sorry, say it again. Preventing Cuba from importing medical equipment and medicines, because that is yet another aspect of the blockade policy that's been in place. But I just want to end by saying, in this moment when, literally the planet is facing a pandemic, the lives of human beings are at risk, solidarity and collaboration are critical. And we believe that no source of life-saving expertise can be sidelined in the fight against this new disease. While the world grapples with coronavirus, we're proud to lift up the work of our Cuban friends who, as they have done countless times before, are willing to step forward and offer life-saving assistance. And that's why many of us, there's too many to mention here, but IFCO, the NNOC, the US-Cuba Normalization Campaign, and many other, the Venceremos Brigade, the list goes on, continue to embrace solidarity with Cuba. We continue to educate people in the US about the impact of the US government's longstanding sanctions against our island neighbor, and fight to end all restrictions on travel to Cuba and to call for regime change in the US and not in Cuba. So thank you. Thanks for this opportunity to share. So much more could be said, but I appreciate the opportunity. Thank you, Tony. Thank you all.
Thank you, Gail. Tremendous. Very good. Covered a lot of ground. Okay, I think one of the things that's important right now also is that the motion across the United States in different ways is increasing around this question of normalizing relations with Cuba, and to especially on the medical level, but also on many other levels. And so the next speaker is David Paul, who is an activist, a local Bay Area person. He was, among other things, he's a retired nurse, but also he was part of the embassy protection group of the Venezuelan embassy in Washington, D.C., when and a group of activists and a number of people were involved, including David. There's a lot of things that David has done. I'm not going to belabor it and go on and on, but I will say this, that he, very, very importantly, he was part of a group of people here in the Bay Area that basically wrote up a proposed resolution of the San Francisco Board of Supervisors. And lo and behold, after waiting and waiting in this meeting for several hours, finally the board took it up and unanimously passed the resolution, which basically called for the city and county of San Francisco for medical collaboration and support and interaction with Cuban doctors and medical personnel, technical personnel. And that, this is a grassroots thing all over the country. This is starting to occur. Lots of different discussions are occurring about how do we move forward? How do we involve elected officials? How do we involve community people? How do we send people to Cuba to study medicine? How do we bring Cubans here? And all these questions. So it's a very fruitful period. So I'm just going to say that just as Gail just said, this is a process that we're looking at, and that there's a lot of possibilities, kind of thinking off of what Gail just said and what Dr. Vela said earlier. So this is David Paul, again, from the San Francisco area. He's going to speak to all of this stuff. So thanks. David, you're on, please.
Hi. You can hear me okay? Am I muted? Okay.
Yeah.
I'm not going to speak to all of this, but some of it, because Gail and Abraham really very eloquently spoke to all these efforts and why many of us want to be involved in this. talking about why we need a new health system and how Cuba, in this country, and how Cuba is an example of that, and how nations should operate and cooperate with each other in the world. And Cuba is another example of that. And that's why I became part of this effort. And in terms of the resolution here, there were 4 of us basically, local activists. We were all associated with the Venceremos Brigade and went on the most recent 50th anniversary trip to Cuba last year. And being part of the Saving Lives campaign to advocate for medical cooperation between the United States and Cuba and ending the blockade in 2 general ways. And as any crisis provides, the COVID crisis really provides an opportunity to show how this lack of cooperation and blockading one country from another is unjust and doesn't make any sense and counterproductive in terms of us trying to deal with the COVID crisis here. And it also seems to be clear that the medical angle, to use the medical justification and the need for cooperation to help with the COVID crisis is a key way to make a break in this blockade of information and this unjust policy toward Cuba. Now, many people have brought up when we kind of followed the resolutions, the experience of the resolution that Richmond, California passed for these same, making these same calls for medical cooperation. And then Berkeley was the next city that passed a similar resolution. So the 4 of us, plus a lot of help from Rita Baruch, who spearheaded the Richmond, California resolution, we put together a resolution for San Francisco. And many people, when bringing up resolutions, say, well, what's the good of a resolution? It has no teeth in it. It's just a statement. And that's true. But it gives more visibility and credibility, we think, to building the broad kind of support needed to actually change policy, from the local efforts to hopefully state efforts on a statewide basis, and then federal. And I think this is true in many efforts of organizing, not just around Cuba or medical cooperation. The things we emphasized in this resolution were, 1, the public health crisis. And from my medical background, I always looked at this public health crisis as we did with complex medical conditions in patients in the hospital. It always brought up it was a basic practice to bring different specialties together, different medical specialties, social services, a collaboration among services to deal with a complex problem. We have a complex problem, a public health crisis, and it just behooves us to look at global cooperation to address it, just like we would do with disease in the hospital. We emphasize the Cuban expertise in dealing with this. They have a track record of success with a variety of medications in treating the disease at different stages. They have expertise in controlling the spread of the disease through their innovative community-based public health system. They have a history of dealing with epidemics in other parts of the countries, as Gail talked about, and current experience with the Henry Reeves brigades in dealing with COVID around the world. And another point we emphasized in this resolution was the already history of cooperation between the United States medical community and Cuba that existed in the past and somewhat revived during the Obama administration with the cooperation about a lung cancer vaccine with the Roswell community in Baltimore. And the University of Illinois was doing a similar thing around infant mortality. But all that cooperation had stopped when Trump came into power. So there's all these aspects we brought up in this resolution. And the other important part of that, to take advantage of Cuban expertise, to really make real this kind of collaboration, was to end the blockade and end the restrictions on travel and communication. So those were the different aspects of it. We first began by having a letter of endorsement for the resolution. We drafted the resolution taking points from the Richmond resolution and one they're working on in Minneapolis, and getting basically individuals and organizations to endorse it. Then we found allies among the 11 Board of Supervisors of San Francisco, finding one person as a co-sponsor. We eventually got 3 co-sponsors, and they basically spearheaded it through discussions with the other supervisors. We had a meeting with the aide of that supervisor to talk about the details of the process. We then, after getting endorsements and after it was introduced to the Board of Supervisors, we had put a massive call out for people to email and call the offices of the supervisors to push them forward to support it. We didn't know what would happen until the last minute of a long supervisors meeting. We had people calling in, making public comments in support, and they eventually passed it unanimously. What may or may not have been true with our resolution and may be true with others, that a lot of the discussions happened behind the scenes among the supervisors themselves. It's hard to know how much the emails and phone calls had an effect, but without them, I'm sure it wouldn't have happened the way it did. We got some discussions about the resolution in some radio interviews, a couple of news articles. We have a press release out. This is part of the follow-up work from this resolution. And going forward, initially we felt, well, it would be great if we had some high-level politician or high-level medical institution person signing on, and some people thought, well, maybe that's what we need. Well, we're thinking we have to look at this in stages. And initially, we think it's important to gather all our allies, people, grassroots people who have had connections and a history of solidarity with Cuba. Many hundreds of people have gone on delegations to Cuba in the past, some even medically related. We want to try to gather as much support from people who've had any kind of connection with Cuban solidarity, drafting us, and with the help of all those people and their connections, draft a statement of support for this proposal, a general statement of support for all these points about cooperating with Cuba's medical community and ending the blockade to make that happen. Connections to religious communities, universities, unions, public service unions, medical associations. And as we gather that support, we then want to focus on medical institutions, biotech firms, research institutes, and the public health department itself of San Francisco. For those are the ones that are going to be very essential in facilitating a direct collaboration. And that could take place, I don't think the blockade's going to end between now and the election, and maybe not after. That's going to be continued work for all of us. But some ways this can happen once we have the enough support and significant people who could facilitate direct collaboration between the medical communities of the United States, San Francisco specifically, and Cuba, is through various methods, webinars, teleconferences, direct dialogues between medical personnel, which they do in this country all the time. Even now in COVID, the University of California, San Francisco, a very renowned internationally medical institution, is having teleconferences around how to deal with COVID. And it just makes sense to bring in people with expertise from Cuba. And that's something we're going to try to work on. We have a little toolkit of things to do to get a resolution going. It's not rocket science, and every community has to sort of tailor it to their own community, use their own language. But we have this toolkit and sharing some of our resources and experience with other cities close by, Santa Cruz, East Palo Alto, who are trying to do the same. And Oakland is also working on a similar resolution. So we help with encouraging more resolutions passed and the momentum that those resolutions give to the community of people trying to promote this collaboration, that this will help build on the national momentum of really doing what's fair to the US people, to have access to the expertise of Cuba, and fairness to the people of Cuba for all that they're doing selfishly for the entire world, as an example. So that's all I wanted to say, to explain a little about what we did and what we hope can happen moving this resolution forward. Thank you.
Thank you, David. Tremendous, tremendous. Very good. What a great program, if I do say so myself. You know, the three speakers really outlined what's at stake here. Okay, so we're going to go to Q&A and comments, but before that, I believe Eugene is going to speak just about the Institute and the work of the Institute, and an important message here. Again, I don't think I did it at the beginning. I want to thank the Institute for helping this move forward. This is the first time I've sort of been one of the co-chairs of a webinar. I've been on various Zoom calls and others where I've been, you know, part of it, but I wasn't kind of trying to manage it and move forward. So I'm learning a lot from this. Okay, so Eugene, you're on next, I believe. Hello?
Hi, Gene.
Eugene? Okay, it took two people to unmute me. So thank you very much. And thank you, Tony, for bringing this panel together. I think with Gail, Abraham, and David, really reminded us of the importance of the work that you are doing, and remind us of what Jay had to say to us North Americans who live in the belly of the beast. And that puts a certain obligation for us to deal with the beast, and we need to work on that. I just want to say a few things more, but remind you that we're going to continue this work next week. August 7th, as you know, is the 75th anniversary of the atomic bombing of Hiroshima, one of the greatest crimes our nation has ever committed. And there are many. And Raj, our comrade Raj, will speak on that. Raj, do you want to say anything about that?
Yes, just briefly that I'll be speaking on the 75th anniversary of Nagasaki bombing. Hiroshima was on the 6th, Nagasaki on the 9th of August. And actually, a lot of people know a great deal about how it happened and the decisions that were made and so forth. What my focus would be to go briefly into that, but also to describe how the issue has been looked at in the United States in the mass media. I did a write on it on the 50th anniversary, 1995. So I will be revisiting that as well as the changes that have been made and connected with the changes that I see happening in US society with this upsurge against oppression of African Americans. And so this is an exciting time in some ways, a difficult time, but I hope people will come and we can have a dialogue. Thank you, Gene.
Okay, thank you, Raj. And I just want to remind everybody that any donations you care to make to the institute will be appreciated. And I put into the chat room how to send us money. I don't like to talk about money, but maybe Richard, our treasurer, wants to say a few words on that. Richard? Well,
Richard is still muted.
Yes, okay. Nothing, we still need money. We need to collect money for our expenses for support of the Nebo Proctor Marxist Library, which is our home. And so far, a number of people have been quite generous, but we certainly need more. So I hope people will be generous and contribute. Thank you, Gene.
okay, thank you, Richard. And now back to you, Tony.
Okay, people hear me?
Yes.
Okay, so we're at 11:43, so we have about 45 minutes, maybe 50 minutes left for the discussion. I'd like first to just again stress to people that their questions or their remarks be brief, because we want to have a really full discussion and encourage people to ask questions. And so I'm really happy that people are here. I'm going to call on Nesbitt Crutchfield first. And Nesbitt was one of the people that was involved with David Paul. Also, he's one of the key people in the Venceremos Brigade in the Bay Area. And so that's it. Nesbitt, please.
Please unmute
Hello?
yourself. You have to unmute yourself, Nesbitt.
All right, can you hear me now?
Yes.
All right. First of all, I want to thank Dr. Vela. I want to thank Gail Walker and to David for their outstanding presentations. I thought it was really clear and very informative. The main thing that I want to say is that, the basic thing that we're talking about from the standpoint of both our friends in Cuba, but also ourselves, is that healthcare is a human right. Now, this is totally contradictory to everything that most of us that was ever brought up to believe or was taught culturally. But listening to and being led by our sisters and brothers in Cuba and the Cuban Revolution, we realize that this is an essential and a very, very important aspect of human and international relations. And I think that the best way that we can convert that cultural understanding of healthcare being a human right is by talking about it from the standpoint of saving lives. Saving lives. It is particularly important to me as an African-American man, as an elderly man, as a man with a number of pre-existing conditions, that the medications, the medication cocktails that are being discovered and being propagated in Cuba throughout the world is something that is not being allowed to me because I am in the United States of America. And I resent that. I think that it is,
Hello?
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 Can you hear me?
Yes.
Yes. Yes.
Yeah. I think it verges on genocide from the standpoint that many of our sisters and brothers in this country and in Canada and in many parts of the Caribbean don't have access to this medication because of the blockade, because of the sanctions. And I just think it's important for us to keep in mind that we're talking about saving lives, and we think that by talking about this, by trying to convince various different boards of supervisors and legislatures of the importance of this, then we can create a groundswell of support for dealing with collaboration with Cuba and I think this is really vital. And I just wanted to say that. Thank you, Tony.
Thank you, Nesbitt. Okay, Roger Harris, please. Roger? Roger had his hand up. Roger. Okay, unmute, please, if you are muted,
Okay,
Roger.
you're right. Okay. Now I'm unmuted. Thank you, Tony, for unmuting me. So thank you very much. This was a really excellent presentation. I very much appreciated what the panel said, but not only what the panel said, but your contributions over the years to the revolutionary struggle, for the struggle for a better world. So thank you very much. I have a question addressed to the panel, but particularly to Gail because of a long association and many visits to Cuba. And that is to address the current crisis. And let me explain what I mean by that. Cubans have succeeded against all odds. They've been brave, they've been politically correct for the most part, and resolute. But that doesn't mean that they'll always be that way. And I think particularly now, we shouldn't be complacent about the future of Cuba and the need for solidarity. Right now, the blockade against Cuba is at probably the worst it's ever been in terms of the screwing down and the sanctions against Cuba and isolating Cuba from the international world market, despite all the efforts by the Cubans to circumvent that. So there's the blockade. There's another factor in which is that one of Cuba's key allies, Venezuela, is in the crosshairs of imperialism and is suffering very greatly. And this has implications for Cuba because Cuba was dependent on Venezuelan oil, which is now not coming there. And it's very difficult to run an economy without oil. And third is the COVID crisis, which is impacting the resources of Cuba internally, but also is preventing tourism to come to Cuba. And that's a source of international support for them and hard currency that they can meet their needs for trade in the international market. So I would ask the panel to speak about the critical need for solidarity and how Cuba is coping with what has been an ongoing crisis for 61 years, but now has really accelerated because of those three factors. Thank you.
Okay, thanks, Roger. I just want to check here. Anyone responding to what Roger just said on the panel, please? Hello?
Gail's microphone is off. Gail,
Who's?
please unmute yourself.
Okay, great. Thank you. I'm sure others have things to say, and I just want to underscore what Roger was saying about the importance of solidarity. I mean, you really laid it out very well. I mean, that Cuba has really been forced to endure tremendous hardship for 60 plus years. And now under this current administration, the punishing blows just kind of keep on coming. And that's why you're right. I mean, I really like the way that you put it. It is not a time to be complacent at all. I think it's really important to have these kinds of forums, these kinds of information sharing activities. I think educating people in the United States, no matter how, I like to say with some of the other presentations I've done, no matter how old you are, if you are if you're living in this country, I don't care if you're a little child, if you're an elder, you've been indoctrinated negatively about Cuba, and it keeps happening. It keeps happening in overt ways and in covert ways. One quick example: I was watching the news last night. This is network news. And they were talking about the hurricane, tropical storm. I don't know what exactly it is, but the storm that's coming and getting ready to come at the coast of the U.S. And they had a map of the region, and they showed the names of even Antigua, teeny tiny Antigua. Cuba was just kind of a blob there. There was no reference to it by name. It's almost like, we'll just sort of disappear it. I've actually in the past seen those hurricane maps where Cuba literally has been erased from the map. I'm like, well, wait a minute, where's Cuba? So there's like in small and big ways, there's efforts to try to, to ignore the nation. The fact that all of the work that Cuba has been doing, the medical internationalism work, which was really, I think, respected and admired, particularly when there was the fight against Ebola, deadly disease. People were literally, fleeing, and understandably, it was scary times, but the Cubans bravely, not to say that there wasn't fear there, but bravely went forward to, provide the medical life-saving aid that they are accustomed to doing. All of those are examples of what, Cuba has continued to do despite this, the boot of the US government on the neck of the people for, 6+ decades. And it's admiring, it's something to admire, but it's just something to lift up and to educate our fellow citizens and members of the world community about. So I just want to applaud what you said, Roger. I think the importance of solidarity is greater now than perhaps it's ever been. There's the blockade, there are the attacks on allies, and there is the COVID itself, which is, a real threat to a tiny island nation like Cuba. But it's amazing what they've been able to accomplish. And I think in much, it's a tribute to their commitment, to their tiered healthcare system, to the way that they, really practice medicine in the country. And it's a real example. So we've got to continue to not be complacent and to step up and do what we can to support our friends and family in Cuba. Thank you.
Thank you, Gail. David, did you have something you wanted to add to this, please? David?
Well, I'm trying to, hi. Well, no, Gail said some things I was going to say, and I appreciate it. No, just the whole emphasis on disinformation and how things can be so slanted. A lot of disinformation in the progressive left as well about all three. I see as the troika of tyranny, as Trump and his people say, that it really is true. If one of, for example, Nicaragua, Venezuela, Cuba, to name a few, but important ones, if one of those is greatly weakened, it really weakens the other two. And it's the importance of survival is international solidarity. And Cuba has been such an example of that for themselves. And that's just highlights more the importance of us here maintaining communications, trying to create dialogue and make visible the realities of Cuba, for example, in Venezuela. I mean, some of the disinformation around Venezuela, they always talk about the 50 countries that support the fake Guaido presidency. They always avoid the 130 who don't agree with that. And on maps, sometimes they don't even mention Africa, which almost every country supports the legitimate governor of Venezuela. And they don't mention much of the rest of the world. So that there's clever ways they use disinformation to discount the legitimacy of the governments in these other countries, the legitimacy of Cuba. And that's, I think if we can make it more visible using all our means, especially during COVID and sheltered, of creating dialogues between the people of Cuba and the people of the United States and Venezuela as well. That really goes a long way to breaking this blockade of information and waking people up that there are human beings there that are being affected. There are human beings who have a right to do what they're doing and make their own decisions about their own society. So it's the disinformation is really important. There's a lot of scrutinizing about the revolutionary processes in these other countries among the left. And I think we really have to look at the broader population and how to articulate the fairness of having just policies toward these countries. And that's all I want to say.
Thank you, David.
Tony, can you add me to the list of people? I can't raise my hand because I'm a
Okay. You're down the road, Raj, but yes, of course.
That's fine. That's fine.
Okay. I'd like to ask Laura Wells to speak now. Laura, are you there? And then also after Laura, there'll be Jim Russell, and then also Henry Lohendorf, and then Raj. Thank you. Laura?
Please unmute yourself, Laura.
I've done it. There I am. Okay, so somebody
Right on.
did something else. Okay, my question has to came up because when I went to Cuba, our guide was saying that one of the important things about the Cuban healthcare system is that all the children get all their vaccinations. And he noticed that there was some shift in the bus because there are people who are against vaccinations. And so my question has to do with what the difference is. I'd be really curious if there's a way to know what the difference is in terms of what vaccinations are required of Cuban children and which ones are required for US children unless their parents sign a waiver. And of course, how that relates to the healthcare system. Because I think that's, that's something that I think would be important for people who are against vaccinations to know that there may be another way to do them. Over.
Anyone want to respond to what Laura just said? Folks? Hello?
Yeah, please unmute yourself, Dr. Vela, and then speak. You have to unmute yourself.
Hi, sorry, it wasn't letting me unmute myself. But in regards to vaccines, yes, every child in Cuba receives all the required vaccines. The vaccines are pretty much the same as the requirements here in the United States. These vaccines are something standard put out by the CDC and by the World Health Organization. There's a chart, you can find it anywhere online, of scheduled vaccines for children. They have shown that they save lives. Vaccines save lives. They prevent children and even adults from getting sick later in their life. Unfortunately, there's many parts of the world where children still die because they don't have access to these vaccines. These vaccines are what we call in Cuba primary prevention, meaning you prevent a child from getting an illness that can really be really detrimental to their health. So what Cuba does, they have campaigns every single year during the school year, usually when kids are getting ready back to go to school, they have vaccine campaigns. And there can be multiple campaigns going on at different times of the year because kids are due for vaccines at different ages. So vaccines become very accessible to everybody. They usually set up a station at the school, and let's say all the 4-year-olds can come in now and get all their shots. All the 6-year-olds now can come in and get all their shots. So it's universal and it is required. I've never encountered in my 6 years as a medical student in Cuba, I never encountered a parent refusing vaccines for their children. And the opposite, they look forward to it. It's not only for vaccines. When we talk about primary prevention and disease control, I was able to participate in a lot of dengue epidemics and the small cholera epidemic that we had in Havana, where we would all go out to the streets, the medical students, physicians, will go out to the streets door by door and look for symptoms, look for symptomatic patients and treat them accordingly, either hospitalize them or provide medications at their doorstep. For the cholera epidemic that we had, a really brief one in Havana, in certain neighborhoods of Havana, we actually distributed prophylactic antibiotics with doxycycline. And it's the community doesn't question it. They know that the public health department is working to prevent them from getting sick. So it was the opposite response. I can't imagine myself going to any household, a random one here in my neighborhood, knocking in here, you need to take these so you don't get sick. What are they going to tell me? How are they going to look at me? They're probably going to call the police. And that's really unfortunate. You know, the lack of distrust from our community to our public healthcare system, but it's understandable. That distrust is understandable. We haven't helped our communities the way that they need us to. We haven't been there for them. You could see how, I know Roger was talking about crises, how Cuba responds to crises compared to how the U.S. responds to crises. In the U.S., a lot of clinics shut down, the hospitals were, limiting patients, where in Cuba, it was the healthcare personnel that went to the communities to treat them. We weren't hiding behind closed doors at clinics, at hospitals. They were on the streets, door by door, and I can attest to it because I've done it myself.
Hello?
I've seen it happen. And it works. It works to contain disease. There's no surprise that COVID has been really well controlled in Cuba compared to somewhere like LA. Unfortunately here, that lack of trust, that lack of good information, of real information, is what leads patients to saying, I don't want to vaccinate my kids. I don't trust my physician. And I understand where they're coming from too. The difference between vaccines there. I never saw anyone in Cuba refuse vaccines at all. It was the opposite. And it goes into the sense of prevention. So I've seen it work, and hopefully we could apply that here in the US. I want to thank all of you. I do have to take off. I have another meeting at noon. I'm running a little late. So thank you all for everything. Please email me if you have any other questions for me. Thanks, Tony, for hosting this, and everybody else. Thank you.
Thank you, Dr. Vela.
Thank you. Thank you.
Presentation, much appreciated. Okay, so, I would like to ask Jim Russell now to come forward.
Okay, can you hear me?
Yeah.
Okay, I have two quick questions. The first question is, what happens with students who come to ALAM who don't speak Spanish? Do they have some program to teach them Spanish before they can participate, or are some of the classes in other languages? The other question is, what has happened with the US program to try to get international Cuban doctors to defect? I think it was stopped under Obama. Has it started again?
People want to speak to that, please?
Gail wants to
Okay.
answer. Gail, please unmute yourself.
Okay, there we go. I'll speak to the first question. David perhaps might be able to speak to the second question, but I'll give it a try. But this first question, the students, when they are accepted into ELAM, because the studies are in Spanish, typically, and I say typically because now everything is turned on its head because of COVID, but typically students would go down probably, a week or so before classes begin. And that would be, they'd go down a week or so before September. And that's so that they can be, checked in and all of that good stuff. Their classes would begin in September. The first half of their pre-med year, that first semester, would be really a Spanish immersion. It's actually pretty fascinating the way it works, because you've got students from a variety of different countries, but the one thing that they're going to have in common is Spanish. There's a Spanish immersion that first half. The second half of the pre-med year is Spanish medical terminology, so that they can start then to get familiar with the terms, and then they'll begin their first year altogether. So that's typically the way that would work. This year, there's been no ELAM, there's been no, what am I trying to say? They've not been able to go down yet because of COVID. More than likely, and now this isn't really carved in stone yet, but more than likely, folk will begin their class, their studies in January or February. So they'll miss that first half of pre-med, the Spanish immersion. So as we are literally having interviews with candidates now, whether virtual, we had one set of face-to-face, socially distant, but we're telling folk, prepare. Like, do what you can to get your Spanish up to speed now. And in whatever ways, you know, we're giving advice on how they can do that so they can hit the ground running at the beginning, the second half of their pre-med year, because they're going to miss out on getting that immersion. So that's the way. David, did you want to try to take on the second question?
David?
He muted.
David?
There it
He
is.
can't be, probably can't
You have
unmute
to
himself.
unmute yourself. I'm asking him to unmute himself.
Okay, yeah, well, I'm sorry for all this. I really don't have an answer for that. From what I've heard, they're just not being very overt about encouraging Cubans to defect. They had a more specific laid out policy. I think they've got a little pushback. I think they just pulled back, this is what I've heard, pulled back from their overt publicizing it, but still doing it less overtly, because they're doing all they can to try to sabotage the medical missions. But I don't have any specifics about a particular change in policy on that.
Yeah, I would just echo that. I don't either. I think that, and I think those of us in the movement have just been trying to really do what we can to underscore the value of these Cuban doctors being dispersed and deployed to different parts of the world, and to try to push back against particularly the Trump administration's just hideous undermining of what Cuba's doing with its doctors. Just trying to fight the information blockade, like David mentioned earlier.
Very good. Thank you both for your comments, and thank you, Jim, for your questions. Raj, you wanted to say something? And then also I'm going to call, after that, I'm going to ask Henry Lowendorf from Connecticut to speak.
Okay, there's also Gulden's hand was up. So if she wants to go, I don't see her hand.
Whose hand?
Gulden had her hands up.
Oh, yeah, but then it disappeared. So, okay,
Yeah,
very good.
Okay. My question, I think Cuba's help to other countries with their medical teams and doctors and their treatments, medicines, etc., is a shining example of why socialism is so superior to the death-wielding capitalism. And naturally, the capitalist world wants to kill it, because it shows to ordinary people where humanity is. And this is a good time because in COVID-19, the capitalist system is exposed. So I think I wanted the people who presented here, Dr. Vela is gone, but he mentioned about how Cuba can specifically help, can elaborate on that in the treatment of COVID-19, because that would be the way to reach a lot of people, because they right now are saying their system is killing them because they're fighting for profit and those who make profit rather than the people's lives are being right now. People can see it. So I think this is the time. So if somebody can explain a little bit more about how Cuba can be helpful to people in the United States in fighting COVID-19, maybe that would be a pressure point. Not with Trump, but maybe the regime that the government that comes afterwards. Thank you.
David, Gail, you want to respond to that, please?
I'll say something. If can you hear me?
Yes.
I'll say
Go ahead,
briefly, and it's been said in the other panelists touched on this also. One is if we can follow somewhat the example of their public health system, it will help us treat any disease, COVID, diabetes, hypertension, a really community-based public health system where your medical personnel are involved and live in the community. They're connected to their neighbors in their community. They have a good database of who is suffering from what. And it's a basic, that system, it's a basic show evidence of respect for the community, and that the patients public have a right to healthcare and that the government is committed to that. So an example of their public health system and the changes that would be necessary here are big ones, but that would help. In terms of their expertise in terms of COVID specifically, they don't have a panacea. This interferon alpha 2b is, I think, too often among us talked as if it's a panacea. It's a magic drug. And I've actually some pushback from some medical personnel. The interferons have been around for 30 years. Alpha 2b is not specifically unique to Cuba. There's variations of it, which they've worked with and actually produced. But treating many diseases, especially new ones like this, it's a combination of treatments. It's a cocktail of treatments, like we treat HIV. And it often involves the timing of treatments, the different, how you use different ways of transmitting the medication, combining with other therapies. There's all kinds of combinations of treatments and approaches that the Cubans have developed an expertise with their numbers and how they're controlling COVID and reducing the deaths has proven. So that combined their experience with their combined approach, plus their efforts to deal with containing and preventing COVID through the elements of their public health system are two things that could help people in the US control COVID and treat COVID. That's all I want to say.
Thank you.
I would just add super fast that I agree with everything David said. It's not a panacea. I didn't mean to imply that, but it's certainly been something that has had some effect there in Cuba. But I think more importantly would be the opportunity. It goes back to the Saving Lives campaign, collaborating, being able to meet with their fellow physicians and to be able to have the communication and what's worked here, what's worked there, what's been effective, I should say. I think just opening up the ability for there to be that kind of communicating and collaborating was huge. As simple as it sounds, with the blockade, it's part of the disconnect that would be I think a helpful start for.
Thank you.
Comment here. I think one of the things that keeps coming across to me, and I become almost every day I'm listening and watching the news online, PBS or NBC or whatever, and increasingly this crisis is really overcoming a whole lot of things. And here's the US government sort of playing fiddle. I mean, it's unbelievable. And increasingly, I mean, we're up to over 150,000 people in the United States who have died. I don't know the exact figure in Cuba who have died, but I'll tell you this, it's very, very low compared to 150,000. So the US, we're number one. And then following behind us, India, Brazil, any number of other countries. But we're way ahead of the rest. And this is the most powerful medical complex. I mean, the United States has a huge amount of resources and it should be sharing them. And so that's just a comment. I mean, I keep thinking about this, how ridiculous and how horrible it is that this has happened. And then here's Cuba blockaded for over 60 years, coming up with new vaccines, coming up with new medications, wanting to collaborate and offering to collaborate, and is collaborating with a number of places, but not in the United States. And this has got to end. This has got to end. Yeah, please go ahead.
You mentioned numbers, and I just want, we put out a thing called IFCO puts out a thing called the Cuba Buzz. We really it's a digest of news about what's going on in Cuba. And every week rather, Cuba posts this information and we just share it. It's from their Ministry of Health. The number of deaths of Cuban patients over the past several months, 87. 87 have died. They've got 2,555 confirmed cases. Most of them have recuperated. 52 have recuperated. 160 admitted for clinical epidemiological surveillance, but 87 deaths. But
Yeah.
I just wanted to speak to the numbers that you just.
No, and thank you for the numbers. I've never been really good with numbers. They go out of my head pretty quickly, but that's the point.
I'm cheating. I'm looking at the Cuba buzz as I speak. Not good either.
All right, I've got Eugene and Ghislaine, and I'll start with Ghislaine, and then Eugene has something. And anybody else that wants to say something, we have about 10 minutes left before we're supposed to stop. Okay. Ghislaine, I'm not pronouncing your name right, but please. Gulden, okay.
She's left the program.
Hi.
No, there she is.
No, I'm right here.
Great.
Actually, my question was around COVID in Cuba. I heard some of the Turkish newspapers, Turkish sites that there hasn't been any incident in Cuba last 25 days or so of COVID ID. So I was going to ask the speakers, what's the reason for the success of Cuba? But most of the speakers already answered this question, and Dr. Vela mentioned the testing, and Gail and David mentioned, what the reason is. So my questions are answered. Thank you so much.
Thank you. There's another person, Henry Lohendorf from Connecticut. He wants to say something, and then I believe it will be Eugene, if I'm not mistaken. We have let me just check what we've got here. Nesbitt as well. Okay, Nesbitt as well. But let's start with Henry Lohendorf on this session. Henry Lohendorf is the chair of the United States Peace Council and is very, very active historically in the Connecticut area. So go ahead, please, Henry.
Please unmute yourself, Henry.
Thank you. Thank you, Tony. I want to thank all of the presenters. This has been very, very effective and very formative. Solidarity takes many different routes. And one of the things that we're doing in Connecticut is trying to reach the broadest possible community. We've had some Cuba Solidarity events, although I have to admit we're not focused on that entirely. And so it becomes one of many other efforts that we're making in terms of the peace movement. By the way, I'm not the chair of the U.S. Peace Council. I'm the chair of the Greater New Haven Peace Council. It's a bit smaller.
Pardon.
That's okay. I never refuse being posted like that. So there are many. This is a question for Gail Walker. There are many students who are poor in my city and around the state. We have in Connecticut, all of our cities are poor cities. We have the poorest, the capital city of Hartford is tied with Youngstown, Ohio for being the poorest cities in the country, and New Haven is not far behind. So we have lots of students from the African American community, from the Latinx community, and from the poor white community who could not conceive of going to medical school because they have no way of paying the bills. And so they're discouraged, as Dr. Vela was. They're discouraged from even considering it. So I'm asking, what kind of packet of information do you have from IFCO Pastors for Peace? What do you have that we can build on and share with teachers in the public school system, with parents, and with the students themselves that point out that there is a way to go to medical school, I mean, without these enormous costs? And I know something about, the fact that not only is everybody provided a scholarship, but also provided with enough money to buy incidentals and so forth. So it's really quite it's an incredibly generous program from a country that has very limited resources. I don't think most people people here do, but people beyond don't understand how incredibly generous this. But the question is, what kind of a packet of information do you have that we can take to the teachers that we know who would be interested, who would pass it on to students, to parents we know that would pass it on to their kids, and to others in the community who would hear about young people who want to go to medical school, but are overwhelmed by the cost in the United States? Thank you in advance.
Thank you so much for the question. When Tony and I were speaking about this program, I said it would be wonderful if we could, the more information we can get out about the fact that the opportunity is still available right now for those who might have their prerequisites in order, but for the future as well. So this is perfect. I'm chomping at the bit to answer that question. There are a variety of different things that we can do. We IFCO, we have brochures, so we can send those. We have a video, it's entitled Dare to Dream. It's a great video that really has, for the most part, the students speaking about US students, graduates, as well as some who were at that point in the program, maybe they've graduated since then, but speaking about the reality so eloquently and passionately, just as Dr. Vela did. So there's that is a video that exists. We are interested in the opportunity to organize virtual, because of COVID. We would do visit schools or try to at least, or open to visiting schools. COVID's making that a little trickier, but we're all on Zoom these days. So there's, if there's an opportunity, and I'd love to work with you maybe on doing some virtual presentations where we can share information. We can bring graduates, because I can speak all passionately about this, but I'm not an Elam grad. Dr. Vela is. And we have a number of other graduates who are working with us who can really speak eloquently to what it means to study in Cuba. So there's the virtual, there's the brochures, there's the video, there's those are at least things that we can potentially begin with. And if there are any specific schools or people at all that you think that we ought to be reaching out to, please, I want to make sure that you have my information. As soon as I finish talking, I'll make sure to put it in the chat. I can be reached by email or cell phone. It's probably easiest right now. But I'd love to hear from anybody who's got any suggestions on young people that we can reach out to. This gift is been going on since 2000. As I mentioned, we've got almost 200 graduates now. It's a 7-year program. It's a commitment. And, but if there's a real passion or interest in becoming a physician, a community, doctor, with the understanding that you're going to be, providing service in underserved communities, this is a tremendous opportunity. It's got to be the right match. Cuba's not a good match for everybody, and everybody's not necessarily a good match for Cuba. But anything we can do to spread the word about this is deeply appreciated. A lot of people will say, "How come I never knew about this?" Well, we're putting the word out as best we can. But anything we can do as a community to get the word out about this would be just golden. So I could probably go on and on, but I was just so excited to hear you ask that question, Henry, because I think that's a big part of the challenge, getting the word out and making sure that people know that this is an opportunity. So I'm going to go ahead and put my info in the chat right now.
Thank you, Gail. Okay, we're winding down here. We got a few minutes left. I see Nesbitt is open, just wants to say something, and then also Eugene from the Institute probably will be the last person, but we've got 5 minutes, more or less. We want to end this on time, and again, so yeah, go ahead, Nesbitt, please.
I'm reminded of the statement that Gail made in her presentation about the response of the United States government to the offer by the Cubans to help in Katrina. And I'm thinking about the fact that Katrina was a catastrophe, but it was localized. We are in a worldwide pandemic catastrophe now. You look on TV and you see United States doctors and scientists and politicians desperately trying to find any and all medications to try to deal with this pandemic, oxychloroquine and at all. And, you know, I think that Cuba has made it very clear, both from the president of Cuba and its ambassador, that they're talking about collaboration and consolidation and saving lives, and that politics should be set aside. And I think that it's important for us to emphasize the fact that the Cubans again are offering to be supportive, they're offering to collaborate, and there is no response, no positive response from the United States of America. And I think that we, in our process of trying to get various different boards of supervisors and state legislators to pass this collaboration issue, we're trying to get people to understand that there is a world outside of the United States dealing with trying to deal with this pandemic, and we should be open to it. I just think that's really important. I just wanted to say that.
Okay, thank you, Nesbitt. I would also mention one thing, and I'll be brief again as much as possible, but it's been spoken about what happened in New Orleans and Cuba's response to the crisis in New Orleans. I'd like to also mention that similarly, after 9/11, Cuba was the first country, literally the first country that stepped forward and said, we will help you, especially the people of New York that suffered this terrorist attack. And once again, the president of the United States at that time, you know, George II, basically just shined them on completely. But literally, they had people at the airport in Havana, you know, several hundred doctors and medical personnel that were put on standby and ready to go. And that's something that, again, here we are, number one in deaths, number one in craziness. And so we need to change the situation. This character in the White House has to go. And we need to do everything that we can in the next bit of time to get him gone. So I want to thank everybody. And Eugene was going to say something, and I just want to say this. I'm extremely pleased that we pulled this together. I'm honored to have the presence of these three speakers. You know, as you can tell, this is a very emotional, important issue for all of us. And I would like that hopefully out of this conversation that we'll move forward and we bring more people into the circle. And we will win. We will triumph. Venceremos. So thank you very much. So Eugene, you're on.
Okay. All right. Thank you very much, everyone, for the wonderful talk. I just wanted to say a couple of things, and I would like a response if we have time. But I was struck also by a number of comments, and Raj mentioned, you know, one of the things about Cuba is it's a socialist country. It's had a socialist revolution. And as a Marxist, I'm very interested in the fact of how socialism compares to capitalism in this and many other regards. But another socialist country, which we've spent some time on, is China. And China has a long history of medical innovations and so on. And I know there have been relations between Cuba and China trying to cooperate in this. China is pretty regularly demonized, even on the left. But I wonder if you have any comments on the medical relations and others between China and Cuba. I know it's a big topic, but I just wanted to raise that issue.
I don't know if David, did you want to say something? You're muted.
Second. No, I don't have much
Okay.
to say about it, although that cooperation is happening. The use of the different interferons and other combination treatments that have shown success statistically among health workers, preventing disease in the health workers in China, and helping to contain the virus in China, has been through a cooperation with Cuban medical community and China. And China's been supportive of Cuba in terms of medical equipment and supplies. That cooperation is ongoing. That's all I can say. Nothing new.
Yeah.
Gail?
Similar kind of a feedback. I know that, following particularly the outbreak of the virus, when you had the mad orange man in the White House claiming, oh, it's a Chinese virus, and you had Cuba, sending doctors and trying to help do what they can to be supportive and supporting the efforts in China. I know that much. Feeling the pressure of time. I mean, if I think of anything else, I'd certainly happily through Tony share more. My knowledge is somewhat limited. I know there's been some collaboration. I don't know a lot more than what David just laid out as well.
Okay, with that, I want to thank the panelists, Dr. Vela, Abraham Vela, Gail Walker, and David Paul, and thank you all for your comments and questions. I feel tremendously moved by what we just did today, and I want to thank everybody for their participation. And let's keep this motion up. Let's move forward. Thank you very much.
And
Institute for the Critical Study of Society at the Nebo Proctor Marxist Library receives no corporate funding, nor do we have any paid staff. We rely on the support of working class folks that share our commitment to the socialist legacy of Karl Marx. We continue to need funds to meet necessary expenses. Since we can no longer pass the hat at our in-person forums, please send contributions to our treasurer, either online via PayPal or by check. The PayPal ID is ICSS Sunday, SUNDAY, @yahoo.com, and the name is Richard Fallenbaum. And checks may be made out to Richard Fallenbaum and sent to him at 1225 Nielsen Street, Berkeley, California, 94706. Fallenbaum is spelled Fallenbaum. To donate directly to the Marxist Library, send a check to the Nebo Proctor Marxist Library at 6501 Telegraph Avenue, Oakland, California, 94609, or directly or donate online at www.paypal.me/npml. For information, write to npml at marxistlibr.org, and the website is marxistlibr.org.